We are a peaceful people. Struggle is we struggle, and we don't look for trouble. Just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass.
Hello again, Guyana, and welcome back to Budget in Focus, our coverage of Budget 2025. Folks, today we're going to be talking a bit about the healthcare sector. I've got Dr. Karen Cummings here with me. MP, thank you for joining us today.
Thank you for having me.
Well, you know, some of the things that you raised in your speech, I think were really interesting, and we want to elaborate a bit on them. But I think the first one that jumped out at me, and I think jumped out at a lot of people, is the severe shortage of nurses that we've got. I think you mentioned public hospital alone is short of 700 nurses. Can you give us some sense of how severe this crisis is nationwide, and why it is that the government isn't paying attention to it?
Thank you for that question, Elson. I just want to let the folks know, our Guyanese citizens know, that we are having a crisis in health. With money pumping into this important healthcare every year, it's increasing. About 20% it has increased from 2024. And are we having value for money? And we need more. It needs to be more impactful. The money that's being spent needs to be seen in the communities, in our healthcare system, in the primary healthcare division, where we're still having an increase of diabetes and hypertension, and and these diseases. And so, for you to build more hospitals and try to say state of the art, to use their terms, and you don't have the nurses to assist in the healthcare delivery, it's really sad. And many of our nurses are migrating, the senior ones. So what's left there, the junior ones, they still need supervision, and so the seniors aren't there to supervise them, and so forth. And so there's less number of healthcare staff to really take care of the populace.
And that, of course, would lead to worse healthcare outcomes.
Absolutely.
You don't have the staffing.
Yes.
One of the things that is interesting, and it's something that it raises a real question as to why the government's not approaching this the right way, is this question of compensation. Because we know that our nurses are patriotic people, and they'd be happy to serve in Guyana once they're compensated in accordance with the profession, and given good working conditions and so on. But the government has really refused to give the kinds of substantial increases that they should. Do you find that to be callous from the government?
It's reckless, as it's indeed callous. I mean, we have the fiscal space to do that, and development must not only mean an increase in wealth and infrastructure, but plus the welfare of the people.
Absolutely.
And so here we have nurses working overtime. So why not pay them properly?
Exactly.
Rather than trying to do a second hustle, as we would call it in colloquial parlance. Pay them properly, that they would stay, because they would at least prevent them from going to greener pastures. And we need them. Not everyone who goes really want to go.
Absolutely.
And so Guyana is a beautiful country. We have the means to do it now, and so let's get it done. So it's a matter of priority. But as you know, the shift will move from people to profits. And so I won't say money for the boys and money for the cronies and the families and friends and favorites, the F club. But our nurses, the frontline workers, need to be better remunerated.
Absolutely. Well, you mentioned a lot of really, I think, interesting points there. One of the things that I find to be concerning about this budget is this focus on removing taxes for overtime, rather than on paying people well enough that their regular jobs can give them a comfortable life. This seems to me to be so backward. But you also mentioned that there's fiscal space. We want to remind our viewers that the national budget from 2020 to now has gone up 4 times over. Have nurses been compensated as this national budget has increased? And that between last year's budget, this year's budget, and the year before, you're looking at roughly 15 years of budgets before oil. So when you say fiscal space, there's a lot of fiscal space.
Yeah.
There just doesn't seem to be the level of interest from the government.
But Elson, even stuff you don't want to give monetary, but there are non-monetary measures that you can probably give. Giving them extra allowance for uniform.
Yeah.
Make sure they have transportation to
Housing
there
as well.
housing and so there are other. I mean, we think it
Yeah.
true. You can be of help, and everyone will have a smile on their face.
Yeah, there's a lot of flexibility in that
Absolutely,
regard.
absolutely.
One of the other things you mentioned, and I think is so interesting, is this idea of them focusing on infrastructure projects, literally building hospitals, even though there isn't staff. That, as you said, it really is a question as to what is the reason for this. I would say disproportionate spending, because you would think that they'd be looking to spend in proportion to what the country's resources can accommodate, in proportion to how many nurses we have, and so on. Otherwise, you're going to have all these empty hospitals, which seems ridiculous. So the question then is the government's focus on, and I don't know any particular scheme, but on corruption somewhere along the line there?
I don't want to give my mouth much liberty, but I mean, if you're going to build a health center or a hospital somewhere, won't you want to do feasibility studies and what's it, have some comprehensive plan and, why I'm doing it and so forth, so we can say, okay, this is the reason. But there's no reason. For instance, New Amsterdam Hospital, that was an IDB project.
Yeah.
So now you're going to move that project or move that hospital, convert it to something else, and just to accommodate, it's foolhardy, disingenuous. I can't really understand what's the rationale of doing that. Why not? It's already existing.
Yeah.
Try to improve on it.
Exactly.
Get more labs, more equipment, and those sort of things. So it's already there, established.
Yeah.
You're gonna put that aside and build something.
Yeah. Yeah, those are all good points. We saw also with the Camberville and Kitty health centers, the idea that they're going to merge those for a cost of $814 million, which was 4 million US.
That's a lot of money.
It's a lot of money, and the question is, are we going to see that much of an improvement in the services that we get that's worth 4 million US? That to me is a serious question. Now, of course, you could take the 4 million US and pay the staff better. And upgrade the machinery and so on.
Absolutely, make us in line with force work. But the thing is, what is a package of service? We talk about package of service when we talk about the health centers, the facilities. So if we're going to merge Camberville with Kitty, what's the package of service that's different that you're going to offer? Are we going to do have surgeries there? What is it that you're offering? Because we have different levels, tiers of health. Health posts, health centers, district hospital, regional hospitals, and then our tertiary.
And what study has shown that this is what you should do, and this is
I don't know whose guy. What's happening. It's just
it's
coming out of thin air.
Yes, just like that.
Yes,
crazy.
But I just hope that good sense will prevail and they will rethink. It's an opportunity to introspect and to see what we have done, listening to both sides of the divide, because we all have the Guyanese interest at heart, health, the health of the nation at heart, and so that the good sense will prevail, and we'll forget about political affiliation. And here is the Guyanese people who we want to improve and ensure that they have optimal health.
Absolutely. One of the things that we talk about a lot that concerns us is the efficiency gap, the way that this government, because it doesn't do studies, because it doesn't evaluate things, ends up spending lots of money and wasting a lot of money or stealing a lot of money. Of course, the speaker has said that we can't use the word corruption in the parliament, which raises the question as to whether the government has corruption on its mind. But anyway, leave that for another day. But really, in the healthcare sector, if you're spending far more than you were, you would expect to see much better results.
Absolutely.
In the past.
Even losing the logical model, your input and so on, the output and the outcomes. And then we have to look at the hinterland. I mean, health and the again, it's not only the coastland. You have the hinterland region. You want to narrow the gaps of the healthcare between the hinterland and the coastland. And then, of course, you're trying to introduce telemedicine and so forth. But then you have to ensure you have stable internet and you have the personnel that's going to read these X-rays and so forth. We started it when we were in government to have specialists, going into their, to those areas, region 1 and so forth. And so we hope that, they will expand that service and have, because they're churning out more doctors and so on. You would expect to see an equal amount of distribution of these doctors around the place, but you're not seeing them. And you don't know where they are. I guess some of these doctors would have left as well.
That is definitely, I think, a great really concern in the health sector. Also, it seems that there isn't really a focus on your outcomes. It's just an output. So the minister spoke about beds. They produce a lot of beds. But are you actually seeing people be healthier as a result? Or are you producing beds without nursing staff to actually help people who are on the beds?
What's the point?
What's the point?
What's the point?
And so just as what I find is interesting as well is some of the problems you see in the healthcare sector are mirrored in the education sector. Lots of schools being built, teachers are not being paid well, performance declining, more money being spent. In your estimation, given the way that the PPP is operating, do you see them ever being able to deliver to Guyanese a first-class, world-class, developed country standard level of healthcare?
Well, as I said before, we have to go back to basics, and we're talking here about universal health access, universal health care, access to care. We're talking about primary care, because that's the first line. That's you see people in the communities, because we're talking about community health, healthy people, healthy communities, and so you're seeing community. The first place you want to go to your health center nearby, and so if you don't have drugs, simple like that. I think we're budgeting more for drugs and medical supplies and so forth, expanding and so forth, but they have a problem with the distribution. Because does it disappear by the time it reaches the health centers? Where's the drug? And so I encourage him in my speech to have a electronic monitoring system. It's in Uganda is a classical example where I can stay where I am and I know what's happening in Kitty and Campbellville. So they don't want that. I don't know. I don't know. So you and so if you know that the amount of the stock is decreasing here, then you can say this has an increase. It's not being used. Let me shift some from this area, to that. I mean, it's not rocket science. It's just in terms of planning and
in fact,
having.
I believe supermarkets actually use a similar system.
Something like that.
Exactly.
Yes,
simple and efficient.
Simple and efficient.
Yeah,
not
but
rocket
simple
science.
and efficient is not what this government wants, because simple and efficient doesn't leave much space for theft. Unfortunately,
absolutely. And as I said, distribution. So by the time it's going somewhere else. Because the Auditor General report. They're paying up front and it's not being delivered. Of course, throughout the Caribbean, and so we have a problem with, because we manufacturing and so on. So you will have to ensure that whatever is being done is efficient and it's well distributed and so. But so the system will tell you about stock level losses and all of that. If you have that system, it's an electronic system, so I don't know why it's not being put into place.
That makes so much sense. One of the things we also want to keep reminding our viewers is that given Guyana's growth, adjusting for prices, the country's per capita income this year will be higher than the United Arab Emirates. So we have to ask ourselves, what are the standards that we should be expecting from a country with that kind of wealth? And to me, what you're talking about is those are the types of systems and mechanisms required to bring us up to that level. But that doesn't seem to be in the government's mind at all. Any closing thoughts you want to share?
Well, I just want to, what you are, you eat, and the health of the nation, the wealth of the nation is the health of the nation. And so nutrition is, we have to eat well, basically. Food, diet, and exercise. That's the kind of mantra for you to have optimal health and to enjoy good health.
Absolutely.
So I want to encourage our members of the public to ensure that you find some space in your garden to have hydroponic farming, to have natural organic foods,
Sure.
And I would like the nutrition department of the Ministry of Health to we are hearing of them, and so that they will able to do more health promotion, in terms of the food, because I mean you have limited money to spend, and so you want to spend it wisely in terms of what you feed, what you give your children to school,
Sure.
so we can prevent some of these chronic diseases which takes makes up about 70% of our budget, in health.
I see. I
Yeah.
see.
Yes.
Very prudent advice. Viewers, thank you for tuning in as we have another discussion here for our program, Budget in Focus. We'll be back with an additional program shortly.